Good afternoon, everyone, and welcome to this presentation of our recent research on the pandemic response in South Sudan. I'll start with a few thank yous. We're very grateful to UK Aid for funding this research, especially the East Africa Research Fund and Jordan Konyongo, who had the initiative to get this research going. We're also very grateful for the Firoz Lalji Centre for Africa, who hosted both the research and are hosting this event. We will put in the chat a link to their newsletter. Sign up for this because there's lots of interesting events coming up, but also because the report based on this research is not quite yet published, and it will be published soon. So if you want to receive it, sign up to for that newsletter, and then it will come your way. Of course, as you'll hear more, this research is really dependent on a large research team, and I'm incredibly grateful to them. You'll hear from some of them today, but those who aren't present include Chol Gu, Chok Biel, Benjamin Duke, Lat Jordang, Umba Peter, Linda from the research people, and also Rose Mabu, who is meant to be presenting today, but who is sadly ill and can't join us. We're also very grateful to Jem Palmer and David Keane, who reviewed the report, and their feedback has been incredibly valuable. So this research was really kind of motivated by us getting to the end of the first year of the COVID-19 pandemic in South Sudan and globally, and us wanting to kind of reflect on where we were. But not just in South Sudan, but in other countries that are like South Sudan. I think we've got lessons to learn. And like South Sudan, in that they were countries, South Sudan was a country where the reported and confirmed cases were very low in the first year of the pandemic. They were in the hundreds, often not the thousands, and let alone the higher numbers we've seen elsewhere in the world. But at the same time, while confirmed cases were very low, the restrictions were very high and the impact was high. And also, as we go into year 2 of the pandemic, and now we're there, we've actually seen a massive increase in cases. So looking at countries like this, where we see a difference between the first 2 years, we wanted to really think about what was the impact of those high levels of restrictions on kind of people's levels of trust and perceptions in public health advice now. At the same time, the report and the research is also motivated by a couple of other things. A lot of the people who did research for this project had also just finished writing about South Sudanese NGOs and the localization agenda in South Sudan. And in that research, there were various findings, but a significant one was that actually South Sudanese NGOs face incredible financial and insecurity, as well as having to take significant security risks. This is despite many of their members being highly motivated and taking personal sacrifices to allow them to kind of deliver humanitarian aid. It also highlighted how South Sudanese NGOs rely on local trust to be able to operate, but often some of their agendas have to be externally driven. And so, being aware that many South Sudanese NGOs and international NGOs are at the forefront of public health advice, we thought it was a good moment to think about how COVID-19 was impacting on South Sudanese NGOs and this localization agenda. It was also an interesting moment in South Sudan because as the pandemic started, there was a situation in where many local government officials had not been appointed. So it was a moment to think about whether there was governance despite there being a lack of government officials. So what we're going to do for the next hour and a half, as we talk through this research, is I'm going to outline some of the basics of the method and then some of the first findings about trust. Then Mo, one of our researchers in South Sudan, is going to talk about his own kind of fieldwork and his first-hand experiences of findings from Juba and from interviews in Gorgriel. Then Peter Justin will talk about local government and local government responses to COVID-19, and Alice Robinson will then talk about South Sudanese NGOs and how they have responded and experienced the pandemic. And then David Keane will kindly lead the discussion by being a discussant for the report, and then we'll open to questions from all of you. So hopefully you'll have many, many questions for us. You can start putting them in the Q&A box as we go through. So don't hesitate, keep kind of posting in there, and then we will draw those out during the Q&A towards the end. So to get going, I will briefly outline the method and then I'll talk very briefly about our findings on trust. So as you'll be able to see here from the map. So the research was a qualitative piece of research, mainly based on interviews. We carried out 99 interviews between November 2020 and February 2021, mainly with South Sudanese NGO workers working for South Sudanese NGOs or international NGOs, and also local government officials, including chiefs, for example. And these interviews were carried out in various places and contexts around South Sudan, including Juba and that big, large urban centre, and the capital of South Sudan, Yei, Yambio, and then more kind of rural areas in Akobo, in Torcheriak, in opposition-controlled areas of Unity State, and then also interviews were carried out in Wau, and phone interviews were carried out into Gorgrial as well. So a mixture of urban and rural, a mixture of government-controlled and opposition-controlled, and covering various parts of the country. Observations as well as interviews were carried out, and the researchers collected various kind of diaries and observations as they went along. So thinking about trust and the way kind of trust evolved in this first year of the pandemic in South Sudan, I'll just mention 3 things that really kind of stuck out from the findings. First of all, COVID-19 South Sudan in that first year, and kind of in many ways remaining the case, became an invisible taboo. So there were fears about it, especially as it hit the headlines in March 2020, but there was also a lot of dismissal of it, a kind of denial that it was there, and people found it hard to believe that it was significant for their lives. But what's clear is that this was not just purely driven by ignorance or driven by a lack of awareness of what was going on around the world, but instead that it was really not a priority for them. For a start, it was invisible in that the virus was difficult to see, not just because all viruses are invisible, but because the symptoms of COVID were hard to ascertain with certainty that it was COVID and not something else. The demographic of the population that might have been affected, especially as it was affecting older people in those first months more significantly, it was unclear whether it necessarily was COVID that was making them ill. And in South Sudan, there was a lack of testing, and any testing that was happening was limited to urban centres, and mainly Juba. And so people could not confirm that the virus was there. So it was invisible, and maybe it was there, maybe it was affecting more people than we will ever realise, but people couldn't be certain. At the same time, people were being impacted by various other potentially deadly risks. There were large-scale floodings in 2020 that were affecting people's homes and abilities to farm and bringing illness. There was ongoing conflict, there were famine levels of hunger in certain pockets. As we entered 2021, there was kind of famine levels in certain areas. And many of our interviews clearly highlighted that COVID couldn't be a priority because other things had to be. As one mother kind of highlighted, how can I afford to buy soap when I can't afford to buy food for my children? Other priorities were there. And that prompted many of our interviewees in different parts of South Sudan to racially code COVID-19 as a kind of white illness, not just an illness that was susceptible to white people, but an illness of people who could move around the world, who were part of those social hierarchies associated and often racially coded, that involved global travel, that involved money, that involved trade, that involved in South Sudan working for NGOs. And so people saw themselves as, having to prioritize other things because of their needs, but also as the only people who could afford to prioritize COVID-19 as being those who were richer and who were therefore able to not face those other difficulties of famine levels of hunger, of flooding and conflict. And therefore people kind of dismissed it, and it became a taboo. Even talking about COVID-19 was often dismissed from conversations. People wearing masks were often ostracized, and it just was not seen as a concern. The second point, however, although the virus itself was seen as not having a significant impact, many people narrated a loss of social harmony, that the virus was bringing a big impact to their life through the restrictions it imposed. The economy significantly suffered. It was already in a difficult situation, but as borders were closed or restricted and companies kind of monopolized the trade over the borders, prices went up and people struggled. Schools were closed, NGO activities changed, churches were closed, motorbikes weren't operating in towns at certain points, and normal social interactions were limited. And this varied over time in different places. Some rural areas continued relatively unaffected because of perceptions of the lack of significance of COVID-19, but there was still this sense of social loss, that actually meeting in the way people needed to meet was not possible. There was economic hardship, and the loss of schools was significant. And so therefore people really felt that hearts had been hurt and that COVID-19 was a time to mourn, but not necessarily because of the consequences of the virus. So the third point then is what does this mean in terms of trusting public health messages going forwards, and trusting health providers? So in South Sudan, there's incredible plurality of public health provision and healthcare generally, in provision of healthcare. There are churches, there are formal government hospitals, there are private clinics, there are NGOs, there are various religious leaders who will provide healing of different sorts. And people are constantly having to navigate this kind of plural environment. And many people narrated how they made judgments based on experience, whether a certain healer or doctor or carer had healed them before or had given them advice that proved to be worthy of listening to before, or whether their friends reported the same. And so this kind of experience is clearly very important in South Sudan in terms of judging who you trust with your health. And therefore, I think as we look back on the first year of the pandemic last year, and that actually many of the kind of priorities of the public health messages turned out to be wrong for many people in South Sudan. They were being told that COVID-19 had to be a priority, but it really wasn't for them. This has impacted the trust they have in healthcare providers, and especially the more formal systems who were insisting that COVID-19 mattered. So I will leave it there and I'll hand over to Ngot Mo. Ngot Mo has researched with us and our colleagues at LSE for 3 years now. He's trained in chemical engineering, but he's an excellent qualitative and ethnographic researcher too. So Ngot, over to you to talk a bit about your experiences of this from your fieldwork in Juba and in Guaguayal.
Very good. Thank you so much, Dr. Naomi, and hello to the team. Now, my name is Ngot Mo. I'll speak on the trust different actors. You know, here, this is not the first, this is the first pandemic. There have been some endemic here in the country, like meningitis, which brought in some part of the country by then. And with all this endemic, which happened like meningitis last time, and Ebola in some part of the country, cholera. So people draw their trust in some of the specific people, which has come up now. When COVID-19 came, it already found the foundations to who do people trust in relation to the health issues. So here I'll speak of two different categories of people: one educated people and uneducated people, as well as those who are educated but have no money. So they will be categorized together as with uneducated people. So here in South Sudan, there are not so many health facilities all over the country. They can find only in some locations, especially in towns. But also in town, there are no specific, there are no more health facilities. So a few of them, and that cannot accommodate the whole population that is in the country, which has led to the people trusting different actors in terms of their health. First of those who are educated, they trust private clinics here, because you find that there are some small clinics in towns. People trust them, and they go in to get advice for their health issues. Also depends on the experienced doctors. You know, people first asked their colleagues, this doctor in that clinic, is he really experienced in helping the issues or not? For example, one of the government workers, he first told me that for him to go to the clinic, he first need to trust his own colleagues who studied with him together in the same university by then, before they got a job. So he will first go to that colleague that he knows. When they were at the university, he was very good in academics. So he trusts that he can treat him. Some colleagues also trust their own NGOs clinics. because here there are some clinics that have been supported by the NGOs. People think that, this clinic may have some of the good medications if you go there. So don't go to this such a clinic. Let's go to the NGOs clinics. Here also in the country, there are some traditional healers or special leaders that are also helping people, especially those who are not educated. Some of us educated, when they cannot find any solution to their health in the clinics or government hospitals, they opt to go to the traditional healers that advise them, you have to do ABCD so that it can be fine. Like, for example, one of the interviewees that was interviewed here in Juba, by then we asked her that, why don't you want to put on the mask? She said, here I want to trust our own traditional healer here in the area more than the mask they are giving me. Because since all this, during the time for cholera, he was advising us and he did some advice to us to follow, and we were safe until now. So we have to stick to this person advice. For your own mask, just keep it. You don't have to put on your mask. This is one of the examples that people need here. Also here, there are some church leaders. One of the examples is there a certain church here in Juba that was shut down during time for COVID because it was not respecting the COVID-19 orders that were imposed by the government. They said there's no COVID-19. So if you want to be okay, to be safe from COVID-19, come to the church, is what they were telling people. And people really, since there was no any cure for COVID-19, they said we have to go for this church. And they had to flock in. You find people full there free night, day and night in that church. So people were only taking advice from that pastor in the church, which led to his arrest. He was detained in prison by the government by then. So these are also educated people. We used to go there. Next slide. Next slide, Alice. Yeah, the second group is educated people and most poor educated. Basically outside the towns like Juba, out of Juba, and also the other states where there are these public health facilities, and also which NGOs cannot be reached to put on the clinics. What they trust most is just traditional healers or special leaders, let me put it. These are people that put their own trust. And during time for meningitis, it came up, they had to go to these traditional healers, told them, people are now dying, there is no government coming up here to reach them, NGOs coming up to reach them. So what they had to do is to go to these special leaders. They had to perform their own things, which really help people. Even if there are people dying, they were telling them, this one will not kill all of you. So anything danger comes, take some of you, but you'll be okay. They trust, even if people were dying, but they trust them. So they have to offer some animals, some goats to be slaughtered, and they put their trust in that. And they also trust any facilities, any medical facilities which is there, even if it is for government or for NGOs, whether it has medications. After failing to get healed from these traditional healers, they'll opt to go to the any facility that is around there. That's the last options. And sometimes lead to the loss of life. They just come at the last minute when the person is almost dying. They bring to the any facility which is there. And one of the examples was, here outside of Juba, there was one person who was sick, and they said this could be COVID-19 because the breathing was not able to breathe normally. They had to rush him to the traditional healer first. That person, he tried to work on him with traditional medications. He couldn't make it. Then he had to tell them, he had brought the person when he's almost out of control. So now try to go to the clinic. People are rushed. They used their blanket to put the person on the blanket. Then they tie some wood there, some 2 woods, and then put it at the shoulders to take the person to the clinic. When they're almost reaching Rajab County, where the small PHCU, it was already out of out of control. That person passed on, and they had to go back to bury that person. They were told, they have to call the COVID-19 team to come and investigate. They say, no. Traditionally, we don't need sample to be taken for this person. So they couldn't allow the samples to be taken. That person was taken back. So this is from my side, and I can pass on to the next presenter. Thank you. you have any questions, you can just type in there. I'll be able to answer the question.
Great, Noor, thank you so much, and for sharing those very moving examples. There's obviously been a lot of struggles in South Sudan, and the way people are avoiding classifying it as COVID is sad but interesting. We're now going to move on to hear from Peter Justin. Peter Justin received his PhD at the end of last year. He has published and is an experienced researcher on land and local governance in South Sudan. So we were very fortunate to have him with us working on this project. Peter, over to you.
Thank you, Naomi, and thanks to the audience also. On my sessions, actually, I'm going to talk on local government and COVID-19. So this section of this part of the report actually tried to see the extent to which local government was able to or not to contribute in addressing some of the issues related to COVID. So just to give you a brief overview, I will talk briefly about local government and epidemics, that is in the past, how they've been dealing with it. And then I will talk about changes in government structure and the local governments. So how changes in government structure affect local governments. Then after that, I will briefly talk about the context at the time when COVID-19 was first detected in South Sudan. And then I will touch on the implication of the changes in the structure of government, and then of the context in relation to local government in dealing with COVID-19. And then after that, I will talk about governance without governments. So if you can move please to the next slide, Alice. So first of all, to begin with, South Sudanese have got long history of dealing with COVID, and local government have been central on that. Actually, this goes up to the colonial, right from the colonial period and coming this way. They have coordinated and liaised with the NGOs in fighting diseases. They have persuaded people, or they forced them actually to isolate as a way of controlling diseases. And in some cases, actually, they have used some of the strategies used by colonial authorities for fighting sleeping sickness, for example, where people are asked to isolate, to clean compounds, or maybe burn grasses in neighborhoods as a way of eradicating excess supply by then. So, and this actually continued not only in the past, but even up to the recent, when during the interim period before the independence of South Sudan and also after independence. For example, in 2014 and 2015, there have been some cases in Juba, situations in Juba where local authorities and then chiefs, traditional leaders actually telling people about outbreak of diseases and raising awareness, telling them what to do and how to go about the things. And they've been very instrumental in that. And elsewhere in the country also, there have been different examples where different stakeholders to local government, including traditional leaders, have been actually addressing outbreaks of diseases in different ways. I remember when I was still in primary school, there have been issues of, what they used to refer to as the Meridi disease. It was actually what was suspected to be Ebola around Meridi and the Ambio. And by that time, actually, all roads were closed. Nobody was expected to leave Meridi or go into Meridi. And this has been happening in other contexts as well. But again, the extent to which governments or local governments are able to deal with the diseases actually is determined by changes in government structures. So maybe to see actually, and right from the start of the civil war, actually in 2013, South Sudan went to a civil war, and right from the start of the civil war, there have been a number of changes in the structure of the government. So in the next slide, actually, I want to tell you, for example, how those changes have taken place and the extent to which they're able to impact on local government in dealing with diseases, for example, including, of course, COVID-19. First of all, as we are aware, or as some of you are aware, actually, South Sudan started with the 10 states during the interim period, and then after it became independent, it inherited those 10 states. Those states resulted from war. it was actually a strategy by the government in Khartoum to create local government structures as a way of controlling populations and also to recruit militias. And then that continued after the start of the war. First of all in 10, and then when the civil war started, the first the first rebel group actually decided to introduce a federal system of government, which is actually suggesting that the country should be divided into 21 states, which was, of course, rejected by the government. And then later on, another group emerged and also suggested that no, instead of 10, we should reduce it to 3 regional governments that existed before the second Sudanese civil war, which was also rejected. But then after that, the government decided to increase the number of the states from 10 to 28, that is in 2015, and then later on to 32. So all these changes, and recently in 2020, they reduced the number of the states again from 32 to 10, because actually it became almost impossible to implement the peace agreement that they had signed with some of the rebel groups, including what is called SPLM-IO. So then they decided to change, to reduce the number of the states from 32 to 10, and then included 3 other areas, which is Abyei and Bibor, and Roing. So the idea is this reduction in the number of the state might contribute to peace. But then all these changes actually are linked to changes in local government. For example, when South Sudan had 10 states, there were 79 local government units called counties. And then when it was increased to up to 32, these counties increased also in number up to 400. So reduction in the number of the states from 32 back to 10, that means the counties had to be reduced as well. And it happened in 2020. And then when the decision to reduce the county was made, all governors were dismissed, of course, with the intention that new governors will be appointed. And these governors were only appointed in 2021, which is about 1 year. So during most part of the pandemic, actually, there was no state governors and there were no local government authorities. So if we can move, please, to the next slide, and then which can give us actually an idea about the context in which COVID-19 started in South Sudan. The first case was detected in early 2020 when the country was going through civil war. There was peace agreement, yes, between the government and the main SPLA group, which is SPLM-IO, and then with the other groups as well. But the other groups which were not part of this agreement. So we had partial peace while civil war was still going on. And then at the same time, like I mentioned earlier, there was a lack of governments at state and the local level. At the state level, the government decided to employ secretary generals or secretary generals to be caretaker government, and then at the local level, at the county level, they employed executive directors. But these authorities or these caretaking authorities actually don't have the powers governors or county commissioners would have. So that means when COVID-19 appeared, they could do very little in addressing COVID. And then because this, and also we had economic challenge, of course, because of the civil war, most of the oil producing areas were under control of different insurgent groups. And most of the wells actually were closed. So the government lacked money at a time that it depended for almost 98% on oil revenues. And then lastly, we had actually, because of the continuation of the civil war, the country was controlled by different insurgent groups. So you have different government, different groups controlling different territories with different local governments. So coordinating activities became a bit challenging. So if we can move briefly to the next slide. So what implications do the changes in the number of the states and the challenges that I've just discussed have on local governments in dealing with COVID-19? First of all, like I mentioned, okay, local governments increased from 79 to about 400. And this made it increasingly difficult for the government actually to fund this local government unit to be able to run or to perform their core functions. Of course, including in the healthcare. Most healthcare facilities are actually run by NGOs. Of course, NGOs also have to get mandate from the government to be able to operate. And sometimes it's a bit difficult crossing sometimes from government control areas to areas controlled by insurgent groups. Sometimes is challenging. Some NGOs literally cannot go there while others can. And then lack of state and the local governments meant that the pandemic actually meant that there was a lack of authority to coordinate pandemics. And most people actually, like the system, people are used to, authority in giving directives in terms of what should be done. But then at the local level government, the lack of commissioners meant that there were no clear people or directives, people to give directives actually in terms of what should be done. And even if orders were given by these acting executive directors, for example, they are not really taken seriously the way they would be taken if they are to be given by commissioners. And then also you have a presence of different structures of government under the different groups. So you have, for example, under the 21 state structure by SPLM-IO, you have different structures. And then under the structure by government, of course, you had by then, it was the 400. And then the 400, of course, some of them are in rebel control areas already, while some in government control areas. And then, of course, you have other groups like NAS, which is National Salvation Front, which was insisting that there should be 3 regions in South Sudan. And of course, in areas they control, though very limited, but still they assume that they can be able to implement these new changes. And then the economic challenge also meant that the government lacked resources to fund efforts to fight the disease. So if we can go to the next slide, please, which is actually the last slide. Okay, and then governance without government. Then the question is, to what extent was governance without government possible? We don't have governments at state and the local level. So to what extent is it possible, for example, for local people to govern themselves? Findings of this report actually confirm some findings from area like Somaliland, where governance without government is taking place. And in this case, it shows that that is also possible. Because of lack of local government authorities, different groups actually have been coordinating activities in different ways to be able to help in addressing cases related to COVID. You have caretaking local government officials and the chiefs are involved in awareness raising in different activities. And sometimes local government officials who are laid off because of the dissolutions of those structures, they come back on voluntary basis to be able to support this staff, to be able to do awareness raising campaign. Of course, it was mainly local government structures that are dissolved, but authority, law enforcement like the police and the military, they are still there. So sometimes actually they try to get help from these authorities to be able to enforce COVID guidelines. And then you have, of course, volunteers from all walks of life who come and they try to support communities by raising awareness and including, of course, on PPE. So though, as it was mentioned earlier by Mo, and not Mo, that sometimes, this COVID thing has seemed to be, is an NGO thing which are meant to, just to confuse people. Sometimes you go and discuss or you take PPE to people, then you are just accused of trying to eat money in the name of the local people. And lastly, and as Alice we'll talk about later, local governments and the local and the national NGOs have played very big roles actually in dealing with the COVID in terms of awareness raising. And of course, we have the civil society and the others. So let me just stop here. And then maybe if there are questions later, then we can be able to discuss this more. So thank you very much.
Great, thank you, Peter. And do remember to put any questions in the Q&A box, and we will get to them later. But feel free to start adding them now. We're now going to hand over to Alice Robinson, who's a PhD student at LSE. She's going to talk about South Sudanese NGOs during the pandemic, and her own PhD is an ethnography of certain South Sudanese NGOs. So Alice, thank you for your help, and over to you.
Great. Hi everyone, thanks Naomi. So I'm going to just talk really briefly a bit about South Sudanese NGO and CBO responses to COVID-19, which Peter has just introduced really nicely, so thank you, Peter. So the first thing to say is that South Sudanese organisations have been involved extensively in responding to COVID-19 in various ways and for various reasons. So amongst other things, across all the research sites, you see them engaging in sort of sharing messages, awareness raising activities by radio and road and in public places. There's lots of activities around sort of making and distributing face masks, soap and hand sanitizer, constructing and rehabilitation hand washing stations, in some cases training health workers and supporting people affected by the lockdown with things like cash grants. And a lot of those sort of messages were informed by and sort of shaped by training and material provided by international organizations like UNICEF and WHO. Some organizations, especially like larger national NGOs and those with a lot of experience or reputation in the health sector, did get more funding to respond to COVID-19. More commonly, a lot of organizations were asked to repurpose existing funding for COVID-19 related activities, or were given in-kind support, so things like megaphones and batteries, or some funding for transport equipment to make face masks, but not funding. And across the research sites, we also see various civil society and volunteer-led mobilizations, especially with local actors seeking to share messages about COVID-19. And interviewees narrated a range of motivations for wanting to respond in some way to the pandemic. So primarily a concern that the people they worked with wouldn't otherwise be reached with information about COVID-19, and that people needed to know what was going on and how to protect themselves. Often combined with a sense that the government in a state of flux would not respond, or that international organizations didn't have a presence in the places where they worked, and that without greater awareness about COVID in wider communities, they and their staff would be at risk. So in Yambio, for example, there was a collective of 6 civil society organizations that came together to try and raise awareness about COVID-19. They sort of went house to house doing awareness raising and did some radio talk shows and shared COVID-19 messages at the roadside and through megaphones. And the director of one of these organizations, a women's association in Yambio, said, since we didn't have a full government in place, we realized that there is an outbreak of the deadly virus called COVID-19. And if we don't give ourselves to sensitize our communities in our local language, they will not fear. This was the reason why we commit ourselves to pass the message to the community, at least as a primary response to them. For others, the response was sort of really driven by the fact that this is what their donors were telling them to do and how to redirect their activities, regardless of how that aligned with their own priorities. So, for example, there was a staff member in Akobo who said, we get our projects from this UN agency, so we have to implement what they have told us. However, the sort of overwhelming focus of attention and resources on COVID-19 largely forced national NGOs to turn away from pre-existing work and priorities. So many have struggled as existing projects addressing concerns that they considered to be as or more pressing than COVID-19 were deprioritized. Quite a lot of interviewees, again, across all the sites, reported having had projects postponed or cancelled, either because they weren't feasible in line with lockdown and virus prevention measures, or because the resources were rechanneled by their donors to activities related to COVID-19. Relatedly, as we talk about quite a bit in the previous report that Naomi mentioned, the way in which many South Sudanese NGOs have been funded by international organisations over many years has undermined institutional sustainability, and that includes things like short-term project-based funding with limited support for core costs and staff salaries. Many work project to project and therefore have little in the way of reserve funding or cushioning for a major shock like a pandemic. And so as funding has been cut, postponed or diverted over the last year, organisations have struggled to stay afloat, and the loss of projects and associated funding has led to widespread staff cuts and in some cases the closure of organisations. But organisations are not all affected, of course, in the same way. Very broadly speaking, larger organisations, especially those with a track record in the health sector, fared better, with some gaining new funding. But the impact was felt most heavily by smaller organisations and those without a base in Juba, and those working on issues especially that involve bringing people together, including peace building and women's rights activities, or that involve activities in schools which were closed for a very long time. In terms of funding dynamics, there was optimism globally and in South Sudan early in the pandemic that it would add momentum to the localization agenda. But there's fairly limited evidence of this happening in South Sudan. Instead, there's a perception amongst organisations consulted for this research that funding is getting harder to access, attributed partly to the pandemic, but also to declining global humanitarian funding and competition for funds within South Sudan. There's limited analysis of funding flows to South Sudanese NGOs. The UN OCHA financial tracking service data suggests that in 2020, local and national NGOs in South Sudan directly received just under 2% of funding for South Sudan, which is a decrease on 2019. And that mirrors global trends. So the 2020 Global Humanitarian Assistance Report showed a decrease in the proportion of all international humanitarian assistance sent directly to local and national actors in 2019. And the analysis that exists of global humanitarian funding for the COVID-19 response again suggests that only a tiny fraction of this has gone directly to local and national NGOs. Obviously, the majority of funding for South Sudanese NGOs isn't direct funding. It goes through subcontracting arrangements with international organisations, which are very hard to track. Some of the organisations we spoke with had received additional funding specifically to respond to COVID-19, but more commonly, organisations were asked to repurpose existing funding to engage in COVID-19 prevention activities, or received in-kind donations, but that weren't accompanied by support for the organisation itself. And although CBOs and campaign groups, many have mobilised to respond to the virus, few of them have received external support for their activities. So the pandemic also interrupted relationships and networking between South Sudanese NGOs and their current or potential donors. So as meetings, including coordination and cluster meetings, moved online, they became harder to attend, obviously for organisations without reliable internet access. And the informal networking and relationship building that had been possible at those meetings became harder without face-to-face contact. Others lost contact with their contacts in international organisations, some of whom left the country, and found it hard to build up relationships with their colleagues or replacements. So the director of one relatively large Juba-based organisation, for example, said, our network has completely broken down, so everybody works in isolation. Others reported that they were finding it harder to reach out to partners and donors for support. And the shift to remote working was particularly a challenge for smaller nations based outside the capital. So the director of a women's association in Yambio, for example, said, so many partners had wanted to support the organisation, but with the outbreak of COVID-19, they changed their strategies, and whatever activities we planned to carry this year came to a standstill, and how to mobilise the resources stopped. Communication was a challenge. CBOs, we didn't have the communication procedures or gadgets where we were exposed to information sharing. And a final slide, taking us back to some of the points that Amy and Ngot were making right at the beginning. So as discussed in the previous report, trust in aid actors and aid interventions, both national and international, is undermined by short-term funding and projects, externally driven priorities, and the centralization of the humanitarian system. And this has been highlighted and in some cases exacerbated by the pandemic. So the perception of COVID-19 as an imported disease associated with international actors and South Sudanese elites has affected perceptions of aid workers, who are often classified as belonging to those elite social spheres. And this includes those working for NGOs, many of whom reported in interviews that COVID-19 had in various ways affected how they were received by the communities that they were trying to work with. People narrated reactions to their presence ranging from fear that they would be bringing the virus, especially in the early months of the pandemic, to ambivalence about COVID-19 and a frustration at the focus on the pandemic ahead of other issues. And modes of interaction between aid workers and crisis-affected communities also changed as staff sought to ensure a physical distance from and between project participants. So for example, we have here's some of the themes as well that Peter was just mentioning. So for example, an NGO contact tracer in Juba said that people said to her things like, "There is no COVID-19, you're just pretending, you just want to eat the money." The director of an organization in Juba said the local community, they see that the corona is being brought by the educated people plus the whites. So even if you try to advocate to them that you have to wear face masks, you have to wash your hands, you have to do this, they will tell you, you know, this is your disease, it's not even ours, it's not affecting us, it's just killing you people. And another director in Yambio said, when you talk of face mask as an organization, they turn it as if it's us bringing the COVID-19. And if you wear face mask, they point at you that there is no COVID-19 and it is you promoting the virus. So perceptions such as these essentially reinforce the sort of sense of aid as something that is extractive, driven by externally driven priorities, and enriching aid actors at the expense of South Sudanese communities, which takes us back to the beginning. And I will stop there and also stop sharing the screen.
Thank you, Alice. And now we're going to hand over to Professor David Keane to be our first discussant. So he will get us going in discussion, and then we will go to the Q&A. I'm sure all of you know David Keane's work on the political economy of famine and of conflict and complex emergencies, including in Sudan, but in many other countries around the world. So David, thank you for joining us and leading our discussion.
A pleasure. I mean, first of all, I think it's a really interesting and really important report, and it raises really some very key questions in terms of how interventions are perceived, and also how risk is being distributed. And the report mentions that there was a fair amount of optimism, for example, from OCHA, around a sort of localization agenda, and OCHA saying that COVID is advancing that agenda. It could be a blueprint for future interventions and so on. But there is a very problematic side, as you're aware, to the localization agenda. And who is it that actually bears the risk? For example, financial risk or security risks, in particular interventions. And I think, you know, the earlier report by Naomi Pendle et al. That I think is in the chat, you know, is really essential background reading on that, and also to this current report. And I think it does show, the current report, you know, that there's a scaling back of non-COVID interventions, and that this is really very dangerous in terms of levels of trust, which are already very fragile, partly because of this uneven distribution of risk, and dangerous in terms of governance, peace processes, and indeed the credibility and believability of the COVID interventions themselves. And I think there is a grave danger here, really, of trust being undermined by external priorities that perhaps differ substantially from local priorities in a way that the report is documenting. And an interesting example, is that perception that perhaps the international community is really concerned about COVID because it's affecting people in the global north, and that actually people in South Sudan have an awful lot of other things to worry about. And many of their concerns and many of their crises are in a way being made worse in their perception by things that they have to do, as it were, to prevent this crisis, which perhaps they can't see. They're being told is really important. They have a feeling it affects white people more, and so on. So there's a huge problem there, I think, in terms of perceptions and a danger of reinforcing what's already a very insecure and difficult environment for NGOs and so on. And I guess part of what I tried to do in my written comments to the report was to kind of look at it a little bit with a couple of unusual reference points, and thinking about the situation in the United States in relation to so-called fake news, people being asked in a way to take seriously, for example, COVID, to take seriously something like global warming. But actually those warnings have come in the context of, first of all, a whole series of other crises that large numbers of Americans would see as more pressing, especially economic crises, health crises, and so on. So they're being, as it were, invited to prioritize particular crises. And then, as it were, this history of distrust between, for example, people in rural areas who feel they've been neglected and the so-called metropolitan elite and so on, which obviously Trump made a huge sort of play of that. But nevertheless, it does, I think, remind us that in a whole range of countries, people can define their crises that they face very differently from external actors, and that levels of trust are very important in terms of shaping the response that people have to whatever crises are being officially defined as important. And I think another interesting comparison, just briefly, is the UK anti-terrorism initiatives, which ostensibly are aimed to prevent terrorism and are directed primarily at Muslim communities within urban areas of the UK. And insofar as these have been studied, one of the main findings, I think, is that people are, for example, Muslims in those towns are being invited to sign up to the view that preventing international terrorism and preventing so-called Islamist terrorism should be their number one priority, but they actually face a whole bunch of other crises in terms of employment, insecurity on the streets, discrimination and health and so on, which are in a way much more important to them. So there's a situation of people being, as it were, invited to prioritize. And I'm not saying the international priorities are always wrong, because clearly COVID is a huge problem and a huge potential problem as well. But I think the report, in a way, in highlighting the perceptions around COVID, this kind of history of distrust, the fragility of trust, the importance of trust for peace processes and for governance, is performing a huge service. And actually, a lot of these issues about how an intervention is perceived and which crises are going to be foregrounded, and what's the difference between an official definition of a crisis and a local definition of a crisis. These are very central issues sort of globally in terms of how we face up to some of our biggest challenges, and whether or not people feel that they can sign up to the prevention of some of these biggest challenges, and whether they're being listened to and respected in a way. So I think it's got, it's got a lot of implications beyond South Sudan as well. So maybe I'll stop there.
David, thank you. That's incredibly helpful and always incredibly good at reminding us to think about the bigger implications of what we are thinking about and how it relates to things going on around the world. So thank you for that. And yes, I think there's a disturbing amount of distrust and those kind of different priorities about what people have to be concerned about and are struggling with. So now we're going to move to questions to the Q&A. For all of you, we will respond to David as well. So do feel free as you talk and respond to questions to also think about what David has said and incorporate that or respond to that if you would like to. But I think it'd be great to start with some questions now. I'm going to start actually with one from Catherine Buckwell. So if that's okay, Catherine, I'm going to read it out and then I will pass over maybe to Peter, then Alice and Ngort, for you to think about your answers to this or anything you want to add in relation to David's discussion. But I think Catherine's question follows on quite nicely because she's asking about what media organisations in South Sudan should do. What information should they share and how should they talk about COVID-19 in a way that it would be believed and trusted? So kind of building on this kind of emphasis about the fact that often messages have not been trusted for the reasons that David outlined and that we've been talking about. Are the ways to kind of respond to this, but the media, and I guess even beyond the media, others such as government or NGOs, how can they rebuild this trust after this lack of trust? So Peter, are you okay to start? Would you like to share some thoughts? And feel free to also, I guess again, it's a theme of trust, but is there any space to rebuild trust, whether by the media or NGOs or government?
Yes, I think it's a very relevant question in terms of, again, media, whether through media or other sources indeed. The question of to what extent are local people perceiving the information to be right or wrong actually is determined by a number of factors. First of all, in some contexts, for example, there are examples in the report where you find that guidelines regarding COVID are being enforced. And sometimes you find that the same people who are trying to enforce it, for example, people who tell you to wear a mask, they don't wear it. Also question of leading by example. Sometimes, people see authorities, for example, telling them that, there is COVID, let's be careful and let's do A, B, C. But in practice, actually, what happens is a bit different. And that by itself, I think, raises question marks. How comes that you're telling me not to do what you're doing? And of course, you can link to different institutions. Again, in relation to media, I think there are a lot of things that media can follow. First of all, there are guidelines, for example, provided by credible institutions like the World Health in South Sudan. I think they're doing a lot. And also, local and the national NGOs are doing a lot also. Of course, they're getting their information from credible sources and funding also from sources that to some extent indeed are intending to fight the COVID, though sometimes for different reasons, but at least there are credible information there that can be able to help people. Maybe people like, Ngort, who has been actually in the field, can tell us actually more on that. But generally speaking, the question of leading by example, I think is a very big challenge in South Sudan.
Thank you. That's really useful. Alice, do you want to add anything? And then we'll go to Ngort.
I was going to say something very similar to Peter, that there's a lot of really interesting stuff coming through in a lot of the transcripts around, I think people basically saying, like, why should we believe something when the people that are giving us these messages aren't following the rules themselves? And I think that there will also always be suspicion when COVID is seen as being prioritized over things that people themselves also see as being really pressing and having been ignored for a really long time. There's a very good report by the Rift Valley Institute looking at community responses to epidemics, and that talks a little bit more about local messaging. Maybe we can put a link in the chat, but I think that's probably quite relevant to your question. But I would hand over to Ngot now.
Okay, thank you so much, Alice. I think this is a very good question from Catherine. You know, here, some media houses have been passing on information to different communities through different media, either through text message on the phone or through radio, through TV. But what, to my understanding, for us to make the media convince the community to trust what is being told to them is, you know, we have to see the actors that they trust, especially the church leaders, that they are being trusted by some communities. They should be part of the team that is passing the information. You know, when they see, as Peter put it, people here just they see the example from you. If you speak to them without a mask, say COVID-19, you know, is killing people, you don't put on the mask. So they say, why not put on the mask? You see the example. That means just only trying to deceive people. But to me, what can be done by the media team is just to incorporate some the people that they trust, like community leaders, the chief, to be also part of the media team that is passing the information to the people. Also, child leaders has to be included when they are really fully equipped with the PPEs, personal protective equipments. When they put on the mask, put on the, let me say, the gloves, all this when they are speaking, they're using the sensitizers, on the back of the vehicle, just moving within the community. They will see them all equipped. And later on, when the pastor goes back to the church, then it should also be with PPEs, equipped also, speaking to congregations. And also when the chief is going back, he has to move for the mask in his communities. You'll see, okay, yeah, chief is now put on the mask throughout. He'll be telling them, put on the mask. They'll put on the mask because they trust them. This is what I can add. And maybe to add on to what David King just mentioned, he said, you know, we have to really prioritize, sit down with the community that are affected. Different communities have different priorities that they have to look at. It is very important when you come to the community, sit down with them, say, what is your key pending issues on your communities? Like here, they said, no, COVID-19 not. You say, maybe just here is, we don't have the mosquito nets. So here you sit down with them, design that, and then when you set the rules that is trying to protect them, they will follow. If you go contrary to what is paining them, they will not even follow you. You say, here, just I'm talking, you don't know what we really need. So I agree with David on that. Thank you.
No, that's incredibly helpful. And I think, yeah, exactly that point you make about obviously some authorities and people with kind of standardized public health messages about COVID-19 have lost trust in the last year because they have not matched people's priorities. But there are other people who offer advice who have gained trust because they have, you know, over time, some of these traditional healers and church leaders, their message seems to have resonated more with people's experiences. And so, of course, if it's through them often in their existing authority that the most impact can be had. So now we will move on to some of the other questions. So thanks for keeping to adding them into the Q&A box. So I suggest we take a couple of questions. So there is one from Laura Nunu about both. So maybe Alice, you can think about this, and others if you want to, about whether it was international or South Sudanese NGOs who really took responsibility for the COVID-19 response or kind of led that response. And at the same time, Mort and Peter, maybe you could, again from Laura, there were questions about the task force in South Sudan and the role the task force played. But that also relates to David Masua's question about the tracing program in South Sudan and whether that had any impact at all. So maybe Peter and Mort, you can think about the task force. So, anything you want to mention about that and the tracing, and Alice, you can mention anything you want about the kind of international and national NGOs. So can we start with you, Alice? Is that okay? And then we'll come back to Mort and Peter. Thanks.
Yeah, so I think the answer to that is pretty mixed. So quite a lot of sort of NGO responses, people would describe passing on messages or materials that they'd received from international organizations. So there were sort of messages that are very much shaped by like WHO and these quite sort of standard responses for how to respond to COVID-19. But then you also see really separate mobilizations of just like groups of people coming together. So like there was, you know, an example in Yambio of 30 women leaders from business and NGOs and a range of different actors that came together to have a kind of campaign group. In Yei, there was a campaign group that was supported by a new national NGO, but again, formed of lots of different people. Yeah, so I just say it is very mixed. And the question about responsibility is really interesting because a lot of the, I think, authority perspectives, you see a lot of like, well, we, I don't know, a lot of sort of responsibility for messaging and response being handed to NGOs and NGOs being asked to take the lead, which makes sense and goes back to a lot of what Peter was saying around the lack of resources that most local authorities across the country have access to run their own services. Yeah, so that's what I would say to that.
Great, thank you. Peter, over to you.
Okay, thank you once again. I can briefly talk about maybe the task force and then track and tracing initiatives, and then maybe others will complement later. The task force, okay, if you look at it in terms of the structure, the task force is supposed to have a national task force, which will go to state level task force, and then up to a local government level. But then because of the same challenges that I mentioned earlier, where, for example, the lack of state government and the lack of local government, and it made it actually very difficult to decentralize this task force up to the lower level. And then even if, for example, at state level, secretary generals were actually having the role of a caretaker, and then at the local level, executive directors, but they don't have the powers which governors or local government would have. So that became actually by itself a very big challenge. They could do very little actually. And most of what they do is actually to coordinate with the NGOs who are willing to support in raising awareness. Regarding the track and trace, I think it goes back to the question of perception, whether COVID exists and whether it's really killing people. Very few people actually go to do testing simply because they don't believe that it exists. And those even who go, the results really, it takes very long before the result is out. And most people who are, sometimes in some cases, actually people are indirectly forced to go and get tested. They end up giving wrong phone numbers and they disappear, and actually call them, or even if you call them, they will not get them. So in a way, the track and tracing system is not working. But again, let's assume all these are responding really, but if you look from the economic perspective in terms of what the resources the government has at the moment, it will be also very difficult. We have, for example, one center for disease control within Juba, actually, which is called John Garang Center, is the only center where people are taken to be quarantined with a very limited capacity. So even if we say that, okay, people who are actually traced to have tested positive, then what do you do with them? In the context of South Sudan generally, where a family, a household, roughly you talk on average 8 people, maybe with the 2 to 3 rooms. So how do you isolate them? So this is actually some of the challenges that are really affecting the people. So maybe other people may have more suggestions on this.
Okay, good. Thank you. I'll just add in some information also, complement what you just said. It's true. You know, at first when COVID-19 broke out here, when it arrived South Sudan, as people put it, you know, yeah, she's coming from outside. So here there are limited facilities for tracking and recording or tracing the COVID-19. By then, there was only national laboratory, which is UNGRA. You would find that only when you go for testing, those who would go for testing was those who are leaving the country. You know, you need to leave the country and then you go for testing. Not even if you're feeling sick, you cannot go there. So they are so much afraid. You know, if you declare that they are positive COVID-19, people look at you in a different way. So some people were afraid just to go for testing there, voluntary testing, except when the flight were also resumed, you could go outside to another country. That was when people could go in, and a lot of congestion there. Nobody could even observe the COVID-19 orders. So the tracking and tracing have been done by the Ministry of Health. There was a department given this task to trace the contact and also the person of positive COVID-19. You know, they could use only that laboratory, which was only one in the whole country by then. And they couldn't trace all the contacts, those who were affected by COVID-19. So they had to resort to another way. They would just track on Facebook. You know, tendency here in South Sudan, when just people are so much generous in the passing information through Facebook. So they just look at the condolence messages being passed on Facebook. And they kept, so every day there was a team which was, a committee was formed to be tracking on Facebook, see how many people have died that day through the condolence messages. And they couldn't really rule out that those are passed on because of COVID-19, because they couldn't go there and take the samples. The relative could not accept the samples to be taken. Also, if the samples are taken, then the laboratory PCR, you can find that it's already congested. There are a number of samples lying on the ground here. It can take some days. So they just only said, okay, now, in the past, there were not so many condolence messages on Facebook. That means now, if there are so many messages on Facebook, condolence, that means they died of COVID-19. So this is whereby at the end of the day, they could just tally. They said, now we've got some 10 or 3 messages on Facebook. Then they put it to the number that passed on because of COVID-19. That's the one. 2, and the effective, let me say, effective tracing and contact was done by the NGOs, national and local NGOs. They could employ the local staff in that locations to be moving within the communities, and they are being helped by the chief or sultan in the areas. So the chief could move with them from house to house because of the protection also. If the chief is not there, then you go put on the mask, they'll just block you at the gate. No COVID-19 here, go, 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 go. So the chief has to support them to move in. And even if they could find a person is suffering from COVID-19, I mean, symptom of COVID-19, they could not bring to the quarantine center, which was only here because the capacity was small. So what NGOs resorted to, national NGOs, they would buy food for you. They say, now for you, don't get out. Because you say you stay inside the house, you stay in your house, where will I get food? Is a question they're asking. You mean to die? You better just to die of, instead of dying of the hunger, I better die of COVID-19. So the chances of me surviving are very high. So NGOs resorted to providing food to the household that were found of COVID-19 symptom. So just stay in your house, then here's the food, don't get out. This is how they try to convince some people to stay indoors that were suspected of COVID-19. Though it was a challenge for them, for the staff that were working for this. And they had to be supported by the communities, also the Payam administrators by then, who were in the Payams. So this is what I can add, and thank you.
Yeah, no, that's an incredible example of South Sudanese NGOs recognizing people's different priorities and trying to kind of combine them together, both the international prioritizing of COVID and people's prioritizing of needing to eat. So yeah, thank you for that really great example, and also for this raising this difficult question of kind of counting and attributing the causes of death. And yeah, and it raises a lot of difficult questions, and that's no new issue in South Sudan in many places. And you know, whether deaths are caused by conflict or by COVID, in many ways they remain, like on a large scale, we just don't know, and we haven't counted. So I think now it'd be great to kind of return to questions of trust, actually, because that seems to have prompted quite a few questions in the Q&A. And just this, Laura Nunu again raises this interesting question. an observation that, of course, it's not just in South Sudan that COVID has been kind of called a conspiracy or prompted a lack of trust, but actually this has happened elsewhere in the world as well. As David mentioned, there are certain parts of the world who often don't trust their government, and this is included about COVID-19, whether that's in the US or the UK or many other parts of the world. So her question is whether some of this trust can be kind of attributed to the global sense that COVID-19 might be a conspiracy, or how we should understand that. But actually, I'm looking to you, Peter, because I know you've had some interesting examples of how the diaspora in other parts of the world and South Sudanese have been kind of having conversations. So I definitely don't think it's just to flow into South Sudan. I think these are kind of global conversations. So Peter, would you like to comment on that first, about these kind of global discussions about how we should prioritize COVID-19 and trust it? And then anyone else who wants to come in is very welcome.
Yes. So the question is whether the global conspiracy is also playing a role.
Yes, and I guess also this, and because I know the question, like the conversations between the diaspora and people in South Sudan as well.
Yeah, I think it's a two-way thing. First of all, you have local conspiracy, and then of course external information in terms of what is happening. Locally, like it was stated at the beginning of the presentation, actually COVID was initially seen as something foreign for white people, or maybe linked to NGOs. And that sentiment has been there. And of course, there have been some perceptions of, South Sudan is hot, so COVID cannot survive in hot temperatures. So it is not for us. It's not for Black people, and it's not for hot regions. But of course, like not mentioned earlier, Facebook, I think, is becoming, or the social media generally is becoming very popular in South Sudan. At least people have access to Facebook and other social media. And that gives them actually access to be able to see what people are talking about, COVID in other parts of the world. And of course, watching countries like UK at a certain point where there have been very big number of deaths and all this, I say, okay, this is confirming what is happening. And even countries like France, where actually very many people are actually resisting vaccination, for example, vaccine. And for them, actually, these are evidences that, we are being deceived about COVID. COVID is not real, and it's not only us denying this, but even the whites denying. But at the same time, though, okay, locally it is perceived that COVID is mainly for white people, but we have seen, of course, in the West, where actually most victims of COVID are mainly Blacks. Because of different reasons, of course, like in UK, there have been reports published actually in terms of what were the causes, actually, what are the causes of Black or the other minorities to be more exposed to COVID and maybe death than others. Surprisingly, in some diasporas, even among South Sudanese diaspora who are abroad, actually, some of them are being influenced by the messages that are being also developing at home. Of course, not only South Sudanese following what is happening outside, but South Sudanese who are outside also following what is happening at home, so that they can be able to adjust to it. Locally, people are using, different herbs, including acacia seeds and others, which they think are treating COVID. And practically, actually, some of these herbs are being sent to Europe. Have been sent to Europe and to America for South Sudanese to use them instead of depending on the pharmaceutical medicines.
Thank you, Peter. That's really useful. Are there any more contributions? If not, we'll move on to another question. So now I think it would be great to turn to a question that was asked by Catherine Buckle, but Liz Hodgkin has also kind of highlighted it. And this is the question of schools. So I briefly mentioned this kind of the pain of COVID-19 in terms of the kind of loss of social harmony, and connected to that, the kind of the downturn a bit in the economy, and the fact that schools were closed and have been closed for prolonged periods of time. So it'd just be great to hear, people's kind of thoughts about that, how people have responded, whether they thought that was necessary. I mean, whether there is any kind of evidence to suggest they should have done that, or kind of, but also, yeah, the kind of local responses to these prolonged school closures. Who would like to contribute first? Alice, do you have any thoughts? And then I'll go to Ngort and Peter.
So I can only speak to things that relate more on the side of organisations that had programmes running in schools, and where there was quite a lot of programmes that had to be suspended for a long period of time and sometimes weren't able to restart because the schools were closed. And then so you had things like programmes that were supporting girls to stay in school, or things like that that ended up being closed, and where then there was a lot of frustration because people weren't able to then follow up with those people, or they lost track of the girls that they were originally supporting. Yeah, there's certainly lots of people that feel like that's led, there's been kind of higher rates of pregnancy because of girls not being in school. So that there's sort of, it comes through a little bit from that angle. But I don't know, I think might have more to say.
Yeah, thank you so much. Here there are different mixed reaction from different communities, starting from the town up to the villages. There's different reactions from them. First of all, the decision is being made by the task force, the government task force, to close the schools. They say we are observing social distancing. And the question people are asking is, in the market, people are operating in the market. You go to the market using public means, you're sitting there together with a person that you don't know. And then also you go into the market like Konya here, whereby yes, there is almost zero distance between you and the person in the market. So they're asking what is the difference between people in the market and the school where people are sitting there. So here it doesn't make sense. These are some people saying that it doesn't make sense to close down the school when the markets are there. People still go to the market and they come back home. So if it is affecting people in the market, it still can affect people in the school. And school is better because you sit at a different distance at school. And they put some saying that this is the decision from the main task force committee or the main government, just to keep our students, of our pupils, still below uneducated, because for them, they have most of their kids already outside the country, and their kids, maybe many of them are already educated. Now they want to keep our kids not educated. So these are just some saying from different communities. And some communities, especially the villages, they like it when the schools are closed, because they have their kids who are going back to them. They stay with them. They help them in farming. They help them in taking care of the animals. So they're happy with that. So there's mixed reaction from different people. This is what I can add.
Thank you, Ngort. Peter, do you have any thoughts on education? Oh, you're muted, I think.
Not for now.
Okay, that's no problem. So we are coming to the end, but I will ask you all one final question, and then you can also include any other thoughts. So Ponciano asks, he's added various interesting comments, but also, and I think it's something that we feel around the world, not just in South Sudan, that COVID-19 has often acted as a way to cover up kind of government failures or other things that the government should be addressing. And I don't think that's obviously just limited to South Sudan. So, and he's basing that actually on kind of comments from social media that he's been watching. So I guess that's a question: to what extent do people really feel that kind of COVID-19 and the discussions about it are just a way to shift priorities or to shift people's attention away from other things, whether that's government failures or something totally different? I mean, also maybe humanitarian failures, not just governments themselves. And then if you have any other points to add before we close, do go ahead. So Peter, shall I start with you? Then Alice, then Ngort, and great, Peter, thank you.
Okay, thank you. Like elsewhere, you know, COVID-19 in South Sudan is also seen from different perspectives, including political, and of course has got some influence up to humanitarian. At the political level, for example, if we look at the implementation of the peace agreement, because actually the dissolution of the government in 2020, I mentioned earlier, is actually was part of the implementation of the peace agreement, so that right away new government is formed, and then members of legislative assembly are elected and sworn in, and some of the provisions actually linked to this peace agreement. But because of, to some extent, the pretext of COVID-19, the country had been 1 year without local government and the state government authorities. And the part of this was attributed to COVID-19. There is COVID, we cannot be able to do this. There is COVID, political leaders at the higher echelon are not allowed to travel to certain areas. And even at a certain point, the vice president, who is the leader of the SPLM-IO, could not go actually to areas where his soldiers are, simply because that there is COVID, nobody should travel. And sometimes even like, if I can quote one of the examples elsewhere, you know, you talk to some authorities in the ruling party, for example, then you say, you know what, we're a political party, we are not Minister of Health. So if you want to talk about COVID, go to Minister of Health or go to NGOs. But if you want to talk about politics, come to us. So these are some of the political implications of COVID, where COVID actually became an excuse in different aspects. And at the same time, also we have, like we mentioned, of volunteers at the lower level who are trying really very hard to help people. Of course, there are those who are doing it genuinely, but there are those also who use it as a strategy to be able to get positions. And the examples where actually some of those volunteers actually, because of that work at the lower level, they're able to get high government positions. So these are some of the dynamics that have been happening. And of course, like about the NGOs, maybe there's been some talk about this already, where COVID maybe is used as an excuse or to divert funds, or maybe as a way actually to stop funding some NGOs as well.
Thank you. Yes, it's a good point about kind of transferring blame, I guess, for things around the pandemic to the scientists and the health officials. I don't think that's at all limited to South Sudan. I think that's definitely something we see elsewhere. So we'll hear briefly from Alice, then Mort, and then David Keane is going to have a final word to end the session. So Alice, over to you.
Yeah, I was going to say something just similar to what Peter was just saying at the end, but this sort of suspicion on a different level between different actors, but this idea that COVID had become like an excuse for international organizations to hold more power and resources for themselves and not to take meetings, and that had impacted the progress of the sort of so-called localization agenda. And it sort of obviously didn't help that COVID was coinciding with the falls in humanitarian funding for South Sudan. So it does seem like funding is getting much tighter and competition is getting much higher. And yeah, there's a suspicion that maybe that COVID-19 has been convenient for people that didn't want to engage. Like how much of that is true or not, the perception itself is really, really interesting. And the point about vaccines and trust in vaccines, I think people are following global debates on the vaccines really, really closely. And you had this sort of painful combination of timings where you had COVAX sort of arrivals of AstraZeneca jabs in South Sudan arriving just about the same time as several European countries decided they were going to suspend them. And you can see how that leads people to think, I mean, obviously they've been reinstated for some age groups, but to think like, hang on, are we getting the vaccines that people have decided aren't good enough for people in Europe? So yeah, I will stop there.
Thank you, Alice. That's really helpful and brought us very up to date. Actually, that's all happened even since the research. Mort, do you have any final things to add?
Yeah, I will just be very brief. You know, when you look at the vaccines, you know, the COVID-19, the government here is trying very hard, though there were so many issues because the government wasn't put in place, but now it is in place. But the Ministry of Health really did a good job in collaboration with the different UN agencies and also the national, local, and international NGOs together. They did a very good job. They were following up with them, and then they were giving them access. They were giving them support through the armed group, let me say the special force of the country. They were deployed there to escort them to some areas, to take some services for COVID-19. So I can say, really, the perceptions on the vaccines is not really from the government or the NGO side. When vaccine came here, the top leadership of the country took up the vaccines. They have been vaccinated. But in the first few days, there were people who were just always on TV, radio, Facebook, checking who has really taken the jab. So it took almost 3 to 4 days or 5 days, actually, when there was no jab. People say, oh, yeah, now they are afraid. They want us to go first. So, but the top leadership of the country took the initiative. They got the jab. Then also the health workers also took the jab, and the NGOs also, both national and international, took the jab also. Though now at a lower percentage rate, not at the high rate. Because people are checking on this social media, the consequences, especially some news from Kenya, that some women are missing the period, some men are not even making their women conceive. So all these people are running away now from the jab. They say, okay, now let's first look at these people who are taking the jab. After 2 months, if there's nothing happened to them, then we will come in. So people are still afraid. They need to see what is the side effect of the vaccines, but not from the government or from national NGOs failures. They're just looking at all international or global perception of the vaccines. So yeah, you know, so if you have some diabetes and you're vaccinated, you will die, is what people are saying. So need first, they're afraid. They don't know their health status. They need first to be very sure. So this, for vaccine, I would even say that more awareness needs to be done to the people. If you have some diabetes, you have to get a vaccine, no problem with you. But now there is this tendency that if you need to take a jab, you have to give the consent to sign. They said, you know, this is really very weird. It looks like somebody's cooking food. Say, take this food, eat it. If you die, don't ask me. So nobody will eat that food. This is what people are thinking now here, that if you sign, that means if I die later on, nobody can ask. Even my kids will not come and ask, why did you kill my father or my mother? So there's still a big reaction here. They say, yeah, if you sign, that means you are going to die and nobody will follow up. So there's more awareness need to be done to the people, especially by the top leadership and also NGOs. Tell them, you know, even when people are being, they take the photos when you're taking the jab. Say, no, we don't trust. Maybe just that is a malaria vaccine that is being given to them. And they say this is this vaccine. They are not trusting that. So there's more need to be done in open place, and then people have to be given some awareness. This is what I can add. Thank you.
Thank you, Mort. And yeah, I think obviously the vaccination question is going to be a big question going forward. And so do read our report when it comes out, and do sign up through the Firoz Lalji Africa Centre mailing list, so to make sure you get it. We have got a section on the vaccine. We'll probably increase that because obviously South Sudanese have a long history of vaccination campaigns. So vaccines aren't something unfamiliar to many South Sudanese in all parts. And responses to those vaccine campaigns have really varied over time. So I think there's a lot to learn from the kind of histories of vaccination campaigns as well as these kind of contemporary responses. So over to you, David, for a final word as we come to the end. Thanks.
Okay, thanks, Naomi. I mean, it's a great discussion. And I think, I mean, it just seems to me there's a common way of looking at policy where you kind of imagine that there's some scientific and educated people on the one hand, and then there's another group of people who are sort of uneducated and maybe inclined to magical thinking and scapegoating and all sorts of other things. And I think, you know, what a huge contribution the report makes, and it partly comes through sort of combining in a way politics and anthropology, is to say, how does this look actually from the other end? And if you want to put it controversially, do you want people to turn their lives upside down to deal with a threat that maybe they can't see, they don't necessarily believe in? It might be asymptomatic, might be seen as affecting other groups of people. And do you want them to sort of increase a number of known risks that they may face, in the course of that process? And then I think, we've heard really clearly how different aspects of politics and history sort of impinge on those perceptions. So I thought, that was really terrific. And Peter, talking about the hypocrisy of telling people to wear masks if you're not wearing one yourself. I mean, that was huge really in the UK, I think, with Dominic Cummings' trip up to Durham. It kind of undermined a lot of the social capital. The perception of a cover-up that Ponciano was talking about, or that COVID might be a distraction. Alice talking about the perception of resources being perhaps hoarded. And, these things, politics is always different, but I think in any country, in the United States, people are bringing this sort of historical perception, suspicion of the federal government, and see an extension of state power and so on behind COVID. And I think it's really helpful as well when Gott kind of brought in that very practical example of NGOs providing food and helping people to stay at home. So I think that's been a big thing as well elsewhere, where, unless you actually provide people with assistance and they're facing economic perils, they're not necessarily going to stay at home just because that's the official advice. You actually have to help them in terms of their own priorities. And so I thought that was a really telling example. But just in a way, I think that I just commend the report for, as it were, reversing sort of a very common way of looking at the policy problem, and seeing how, and documenting how things are perceived and how politics feeds into that, and how fragile people's trust really is in the information they're provided with, and how they often have good reasons for being distrustful, and sort of using that as a starting point.
Thank you, David. Thank you, all the speakers. Thank you for those who have attended and participated through the Q&A. I'm really sorry that we haven't answered everyone's questions. There were great other questions from people like Henry and Sophie and Queen. So I'm very sorry we haven't had time, but thank you for contributing. Do continue the conversation with us. Do sign up for the newsletter and get the report, and have a lovely evening. Thank you.